Hello, Dean, you're on the air.
Yes, sir. It's a pleasure to speak with you, sir. I've been following
Thank you
since 1996, a long-time listener, first-time listener to this program, and first-time caller.
Okay.
I'm calling
how can we help you?
my significant other. My significant other is dealing with a rather critical situation, so I'll describe this. It's fairly involved, so I'll go through quickly. Sir?
Go ahead.
Okay. Her name is Jean, and she is 71 years old. She's in good shape overall. She is 5'3" and 101 pounds currently. Historically, she's usually about 112 or so. 3 years ago, Jean was diagnosed with anal cancer. She went through radiation and chemo, and after 6 to 8 months was able to have a pretty much normal life for about a year and a half. Last February, she started noticing an ache in her tailbone area. After a barrage of tests and multiple medical opinions, it was determined that she had a major stricture or closure in her colon caused by either scar tissue from the radiation or diverticulitis. This stricture caused her bowels to back up and caused the pain. So on September 30th, a month ago, she had a bowel resection to remove the stricture and was given a colostomy. And at that time, the surgeon noticed squamous cells, or cancer on the abdominal wall and the rectum, most of which were removed, along with about a 6 to 7 inch section of her colon for a biopsy. The pathology report confirmed that the diffused cancer, not an enclosed tumor in the abdomen. There were complications from the first surgery, and 3 days later, a second surgery was necessary to remove the hematoma, or pooling blood in the abdomen.
Okay. How much does she weigh now?
About 101.
You said 101? Yeah, okay. All right. Anything else other than this cancer? Does she have diabetes or high blood pressure or arthritis?
Not at all.
Okay. Charmaine, you there?
Sure.
Okay. It's a cute couple, Dean and Jean. I think that's kind of cute. And Jean, his significant other, is 101 pounds, about your size, 5'3", 71 years old, a little bit younger. But she has cancer, squamous cell cancer, in her lower bowel. She's had some of her colon taken out and so forth. And she's got this active cancer, in her pelvic cavity down there where her colon was. And what would you do for her to support her immune system and give her what she needs to maintain herself? There's no guarantee that anything we do is going to, quote, cure, unquote, that cancer. We can support her immune system. And I deal with a lot of people who, doctors say, well, you might only have a year to live or 3 months to live. And so we give them our program. And instead of 3 months to live, they live for 3 years, okay? And so we can improve things for sure, but we cannot guarantee a cure when it comes to cancer. So what would you do for Jean, who's 101 pounds and has squamous cell carcinoma in the tissues in her pelvic area?
Well, the important thing is she needs to clean up her diet. No wheat, barley, rare oats, no oils of any kind, no fried food, no burnt animal fat. And then she needs to get on one healthy brain and heart pack and add a bottle of selenium to that. And if I was her, I would end up taking the Fucoid Z also. And I would also take the Oxybody every day.
I know that's your favorite, yeah.
Well, it's proven. I mean, Dr. Wallach won the Nobel Prize for the discovery that cancer cannot tolerate oxygen. That's a fact.
So Dr. Wallach, okay.
Yep.
Okay. So anyway, again, we cannot guarantee a cure, but you're right. At 101 pounds, how much of the Oxybody do you take every day, Charmaine?
Well, I go in spurts, but, I use an ounce a day. I don't have cancer, though. If I had cancer, I would take a lot more than an ounce a day.
Okay, so she should take 2 ounces a day, ounce at breakfast, ounce at dinner time of the Oxybody. And I also want her to have the Pollen Burst, another one of our antioxidant products that supports the immune system. I'd have her take 2 of those servings a day of the Pollen Burst. It has SOD in it, very, very strong anti-inflammatory. And then the most powerful antioxidant we have in our system is the BTT 2.0 tablets, which will not replace, is not interchangeable with the BTT 2.0, which is the powder you're going to get with the Healthy Brain and Heart Pack, which is vitamins and minerals. You still got to take the BTT 2.0 tablets. And I just have her take 2 bottles a month of that, so she can take 3 twice a day or 2 3 times a day for a total of 6 a day. And Shar said the magic words right at the beginning here, Dean. No bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, bread, no sugar, because we don't want to keep driving that cancer while we're trying to shut it down.